Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about hCG levels in pregnancy. Now, hCG stands for human chorionic gonadotropin hormone, and this is the hormone that is secreted by the cells around the embryo that eventually make the placenta. What is interesting about hCG is it ends up rising in the pregnancy as soon as implantation happens. And this level, when it's over 5, we consider that as being pregnant for the woman. So, in pregnancy, there is a huge range of hCG levels. So, it's important not to compare your hCG levels with somebody else's. And even for a woman who is having different pregnancies, her hCG levels can be different depending on the pregnancy. So, what is an important takeaway about your hCG levels is number one, if you are pregnant or not. So, basically, if that level is over 5, then we can usually assume that then that woman is pregnant. And also, is the hCG increasing at a normal rate? For most women, for a normal healthy pregnancy, it is going to double every 2 days. Now, saying that, it does not always double every 2 days for everyone in a healthy pregnancy, but as long as there is a general upward trend, usually that is a good sign. Now, where we start to worry is if the hCG is staying pretty similar or even dropping, then that can indicate either a miscarriage or an ectopic pregnancy. And also, if the hCG is really, really high, then it could indicate abnormalities such as gestational trophoblastic disease. I'm going to go ahead and insert a chart here just so you guys can see a range of the numbers for hCG. And what you can tell is because of these ranges and how much they vary, looking at your specific number for hCG is not really a good indication of how far along you are in the pregnancy. This indication for how far along you are in the pregnancy is going to be that first ultrasound scan, as long as it is over 7 weeks. But your hCG is not going to give you a good range as to how far along you are. Just because someone who is 4 weeks pregnant could hypothetically have the same hCG levels as someone who is 7 weeks pregnant, but because the ranges can overlap, that's why their numbers are the same. And it does vary from person to person with where your hCG levels are going to be at. Of course, this is always something good to discuss with your doctor if you are worried about your hCG levels not rising appropriately, or if they are not really in that range of normal that you were expecting, or if you are having any sort of concerning symptoms, especially in the first trimester, like bleeding or spotting or cramping. Then your doctor may want to go ahead and check your hCG levels again, just to make sure that they are rising and acting appropriately for your gestational age range. And also, something else to note is that when you take a home pregnancy test or when you pee in a cup at the doctor's office and it tells you whether you are pregnant or not, that is basically just a baseline level that they're looking at with your hCG. But when you are getting your blood work drawn, that is where they're measuring the actual levels of hCG. So that is where the number of your hCG is going to be coming from, is actually your blood work. Hopefully this has been a helpful video for you guys in what hCG even really means in pregnancy. And if you guys liked this video, please consider subscribing to my channel, as well as leave me a comment if you have any other questions about hCG. And you can also check me out on TikTok as well.